Hello, my name is Maria Tanase, student ID number 41 38 73 91. In the dynamic healthcare landscape, professional and personal development opportunities improve care provision. In this presentation, I will analyze my experience as a healthcare support worker about my coping strategies concerning sector growth, self-reflection development, communication, teamwork, and emotional resilience enhancement. The emphasis on compassion, value, and ethics in health and social care has influenced my caregiving and collaborative skills. I will present the key learning milestones and highlight the strengths and the gaps that I have, which illustrate how SPD and reflection have enabled this journey. This evaluation outlines my planned approaches to maintaining sustained high standards in caring while further developing my competence and confidence. When learning how to integrate healthcare with technology, I have gone as far as learning to work with electronic health records, remote monitoring systems, and the NHS online system. Patients' record updates, communication facilitation, and real-time monitoring are made possible because of these skills. Prevention of infection now greatly focuses on post-COVID-19 practices, and for good reason. With guidance from PHE and NHS, I have adjusted along this line of PPE, sanitation and isolation protocols so that my daily routines can meet these standards. This enables a safe environment for the patients while safeguarding the clinicals. The multilingual aspect of Britain makes its population inclusively diverse. I have taken it upon myself to understand how to deal with people of different cultures, religions, and languages in a manner that I don't discriminate and that is personalized. This has been made possible through diversity and equality training, mainly because of the stress patients and families have to go through in healthcare settings. I have developed advanced listening skills, empathy, and stress disengaging techniques to make sure that distress management, as well as patients' confidence, is improved for working with colleagues under pressure. My new training in mental health first aid and safeguarding has kept pace with the growing issue related to mental health, especially after the pandemic. This helps me identify critical signs, provide preliminary assistance, and direct patients to the right service. I attended and participate in team huddles, provide notes in huddles, and work closely with nurses, therapists, and social workers. Collaboratively with various specialties integrates aspects of care into a single plan to address complex and multiple patients' needs. I use give cycle of reflection to systematically work through experience from describing an event to analyzing what happened and developing a plan of action. The model enables learning from both wins and failures, particularly in emotionally nuanced caring context. Through reflection, I know how to assess myself, such as with communication skills, which I'm good at, as well as more advanced, clinically relevant skills which I'm not so good at. This helps shape my professional growth while keeping pace with changes in the industry. Comments and feedback from supervisor, patients, and colleagues are important to me. Analyzing them constructively within the context allows me to make changes, be it in interpersonal interaction or in technical aspect of patient care that enhance safety and effectiveness. I adjust my practice after reviewing case outcomes and evidence-based guidelines, ensuring I keep up with current best practices. This demonstrates to me that I can reason and use evidence to enhance patient care and myself professionally. Reflective practice aids me in managing and understanding my emotions, especially during difficult moments such as losing patients or working through emergency high-pressure situations. This contributes to my emotional resilience while guarding against burnout. The reason I search for opportunities to pursue further training and development as well as professional activities is a consequence of my analytical evaluation. It inspires me to pursue further education and opportunities to enhance my skill set in order to be competitive in a rapidly evolving healthcare setting. Through this experience, I have advanced my skill in providing person-centered care to emotional recognition. This involves listening to the patient's concerns, providing emotional aid, and protecting their self-respect, particularly among more sensitive groups. My outcomes are apparent in the compliments and positive feedback from the patients and families. Using communication provided me with new teaching opportunities, for instance during reflective practice, which helped me learn how to engage with people from different backgrounds. In every situation, I aim to observe compassionate and respectful communication in line with NHS guidelines and policies, whether I am explaining a procedure to a patient, shooting a distressed patient, or working with peers. I always ensure that there are working boundaries, appropriate regard for privacy, and that I take responsibility for my actions. I learned about professional ethics from CPD seasons and other real-life experience where I encountered difficulties while trying to meet standards in professionally high-stress situations. My competencies in self-regulation by managing one's feelings have improved, enabling me to remain calm and caring in even the most demanding situations. I have also learned how my actions affect other people, which I know used to improve the perception of team performance and patients' care in my health institution. Most recently, I have made measurable progress in the area of cooperation with multidisciplinary teams. My contribution to handovers, assisting colleagues during busy shifts, and shifting my work role based on the team dynamics indicates a higher level of flexibility on collective responsibility. The emotional and physical aspects of work in healthcare setting can be tough. I have been able to build resilience by using mindfulness practice efficiently, managing my time, and obtaining support as needed. These strategies have enabled me to uphold performance and compassion in difficult times. I have participated in actively fostering equality and diversity, which have enabled me to appreciate and acknowledge difference in culture, religion, gender, and disability. This demonstrates my dedication to inclusive and value-based care. My ability to perceive and address gaps in care planning has considerably improved. For instance, I now have the confidence to voice concerns or provide what I consider to be reasonable initial observation that support patient safety, marking a shift in personal initiative and professional judgment. Throughout time, I have enhanced my empathic abilities by stepping into patients' shoes. Currently, I work harder to listen and attend to patients' needs with greater concern and respect. This change has improved the way I provide physico-social support. I have improved in meeting particular preference of care, including cultural and emotional consideration, demonstrating inflammation of compassionate care value. This signifies understanding deeper elements such as dignity, respect, and autonomy, which are guiding principles of healthcare compassion. Reflective practice and feedback have encouraged me to be more accountable for my professional responsibilities. Therefore, I have become more critical in my work. Compliance with protocols and completion of care tasks to set standards of quality have become customary with me, demonstrating honesty, responsibility, and ethical behavior. In high emotional context, I have learned to manage my stress, frustration, and sadness in a calm and supportive manner while remaining composed. Such behavior extends benefit to patients and will sets a described standard for my colleagues. Interaction with my peers have become more supportive and collaborative. I recognize thus compassion in the workplace entails helping during challenging shift, appreciating the efforts of colleagues, and fostering a positive environment at work. Currently, I look for ways to receive feedback about my action and their impact on others. I view feedback as an opportunity for growth. Whether it's learning how to better communicate, changing how I address a patient's distress, or responding to their distress in another way, I view every encounter as an opportunity to deepen my compassion and professionalism. My understanding as a healthcare support worker has been through empathic values, professional behaviors, and self-improvement. Reviewing the scope of their work, evaluating core competencies, self-reflection, feedback, learning, and self-advocacy is responsive. Compassion and culturally sensitive ethics, along with an appreciation for qualitatively complex relations with people, emotionally shaped most of my work with patients and employees. Through CPD, I have been able to address the gaps and build resilience for future challenges. Therefore, I would like to commit myself to adaptive elevation, professional discipline, and clinical care while dignifying, respecting, and showing compassion and empathy towards every person I have the honor of supporting.